Hello everyone, and thanks for watching today's video. Today I'm going to talk about a very rare condition called gastric volvulus, or in other words twisted stomach. Now some of you must be wondering that why did I call gastric volvulus a rare condition? Because we all have a stomach, we all eat, we all drink. Why does not all our stomachs twist? Now to explain that, I made this little model. Think of this bag as the stomach. That's the esophagus or the gullet coming from the mouth up there, coming down. That's the diaphragm, which I've explained in my previous videos, is a sheet of muscle that separates the chest from our belly, from our tummy. And there's a little hole in the diaphragm through which the gullet or esophagus comes into the tummy and joins the stomach. This hole is called the hiatus. Yeah. And when this hole becomes large, then we call it a hiatus hernia. Again, that is in my previous video. Now that's the stomach, and stomach ends into the first part of the small intestine called the duodenum, yeah, which is the C-shaped structure over here. Now you can see, you probably can see it a bit closely. If I take you closer to the stomach, you can see that I have fixed the stomach with sellotape. And because of that fixing, if I eat or drink, the food goes into my stomach. There is something in this bag already. If I try and move it, I can't move it anywhere. If I want to twist it, I can't twist it anywhere. Now what will happen if I take some of this sellotape off? So if I, for example, take the sellotape off on this side, yeah, and perhaps from here as well. Now my stomach is not as stable as it was, and you can see it can twist in this direction. Now if this tape is still in place and the tape down here is gone for whatever reason, you can see my stomach can twist this way. So these tapes are very important to keep the stomach in place. Now let's remove this bag and look at what actually happens in real life. Let me try and explain this a bit complicated looking picture that I've drawn. So at the top we have got the esophagus or our food pipe. That blue dome over here and over here is our diaphragm, and there is a hole in the middle of it through which the esophagus from the chest comes into our abdomen, and that hole is called the hiatus. This is green thing here with the crisscross is the liver. This green thing here with the crisscross is the spleen. And this green thing down here is the large intestine of the colon. That's our first part of the small intestine called the duodenum. Now you can see all these red strands I made. They are the same as the sellotape on the bag. They stick the stomach down. So stomach is stuck down to the diaphragm, stuck with these strands, to the liver, to the first part of our small intestine, to the colon and to the spleen, and also to the back of the stomach. So when we eat or drink, the stomach can expand like a balloon and go down like a balloon once it's empty. However, it cannot move around. It has got no flexibility. Like the bag was fixed, the stomach is totally fixed. However, in some people, problem happens. They could be young, they could be old. However, in my experience, most of the people I've seen are over the age of 60, 70, or even older. These attachments to the stomach, like we took the sellotape off, they don't work as well, or they are stretched out. These attachments are called ligaments. They're not obviously sellotape, they're tissues which are called ligaments. So between the liver and the stomach is called gastric ligament or gastrohepatic ligament. Between the diaphragm and the stomach and the colon, gastrocolic ligament. So these are all called ligaments. Now what happens? These ligaments in some people are not strong, or they are too stretched out, or they are too flaccid. So instead of being tight, instead of being very tight, like a rope, they are like this, very floppy. And when they are so floppy, say for example, if this part of the ligaments are not working properly, then there is nothing fixing the stomach here, and the stomach can flip on this side. If these ligaments are flimsy or floppy and not working properly, the stomach is not fixed on this side, and the stomach can flip on this side. So stomach can flip across this way or this way. Now, if these ligaments are not working properly, then this bit of the stomach can flop upwards. So if I go back to the bag, so instead of the stomach, if you think of this bag as the stomach, if the ligaments over here of this end are not working properly, this end is free. So stomach can flop this way, and it's a twisted stomach. If these ligaments are not working, this one or these one down here, then the stomach top end and bottom end is fixed, but the middle bit is not fixed anymore, and it can twist. Now when it twists, you can see the top end of the stomach is twisted, bottom end of the stomach is twisted. So we got a blockage at the top end of the stomach, and we got a blockage at the bottom end of the stomach. So the main symptom these patients get when they present to the doctors is vomiting. Now some of these patients, vomiting is off and on, so they sometimes vomit, they sometimes don't vomit. In some patients, it is a very sudden episode because the stomach twists and it cannot untwist anymore. When it cannot untwist anymore, the stomach is completely blocked. Nothing will go down, nothing will come up. So they want to retch, but nothing will come off the stomach because the top end is shut because it's twisted. Whatever is in the stomach cannot go through into the small intestine because the bottom end, because it twists, like a twist in a hose pipe, yeah, it's completely blocked. Nothing will go through. So the second presentation of these patients is they become acutely blocked, suddenly blocked, but completely blocked. And when they get blocked suddenly, they just continue to vomit and cannot keep anything down. So the main three symptoms these patients complain of is obviously vomiting that we already spoke about, abdominal pain because stomach is bloated, it's can't empty, can't take anything in. And the second problem, what happens is once the stomach is twisted, the blood supply going to the stomach also get obstructed. Now luckily our stomach is very rich in blood supply. It's got 4 very good blood vessels which supply the stomach, and stomach can survive even on 1 blood vessel running properly. So I have never seen a completely dead stomach because of gastric volvulus, but however I'm sure it can happen in severe conditions. I have from time and time again have seen patients because the twist in the stomach which has not been resolved, has not been treated for a few days, and is completely twisted, nothing is going through, and the blood is not going through completely, that the inside lining of the stomach, because as you know, the stomach is like a bag, it's got lining on the inside and lining muscle on the outside. The inside lining of the bag cannot take very well if the blood flow is not good. With a twist in the stomach, the blood flow is compromised, so it's not as good as in a normal stomach. So the inside lining ulcerates. When it ulcerates, patients start bleeding. And one way of bleeding is obviously they vomit blood. Sometimes they pass blood from down below in their stools, black motions, tarry motions, or very dark motions. However, mostly they vomit blood. So these are the 3 main symptoms that I have seen over the years. Mind you, many of these patients, when they present, are quite later on in life. They're quite frail because they have not eaten very well over many, many years. But I have seen 2 types of presentation. One is a chronic presentation that I call it, which means it's been happening for a long period of time. They've had these symptoms once a year, twice a year, once every few months, which is off and on. So they get tummy pain, they start vomiting after eating something, and after a day or 2, it settles down and their life is back to normal. And again, it happens after a few months, and again, life is back to normal. In some of these patients, they become suddenly acute, or it might be that the patient first time presents as acute presentation. Acute presentation means, by that I mean that stomach is totally twisted, totally blocked, and it's not unblocking, it's not untwisting. And these patients are very, very poorly, very unwell. And they cannot keep anything down, they get very dehydrated, tummy is very, very sore in the upper part of the tummy. The reason is because stomach is losing its blood supply. So stomach has a risk of perforation or gangrene. And these patients are usually admitted in the hospital because they cannot cope at home. They're in so much desperate problems. And these patients will require some sort of urgent treatment. Over the years, I've seen many of these patients. Only few, as I recall from top of my head, had ever required surgery. Only few, maybe 1 or 2 out of 15, 20 I might have seen. These ones, I don't know how many I've seen, maybe a dozen or so over the years, but I cannot recall anyone who did not require an operation on that admission as an emergency. Now, how is gastric volvulus diagnosed? The three main investigations is endoscopy, barium X-ray, and CT scan. Now, clinically, with just examination, patient history, because the same symptoms can happen with other problems of the stomach, like stomach ulcer or cancer, etc. This is very difficult to diagnose clinically. As I said, against a very rare condition, some doctors probably will not see one in their lifetime, in their whole career. So it's a very rare condition. So endoscopy is, it can suspect gastric volvulus. Endoscopy in these patients is quite tricky, very difficult, because the stomach is twisted and the camera does not go around the bend easily, and it tells you that the stomach is not normal. You cannot definitely confirm it's a gastric volvulus, but you can say the stomach is not normal. CT scan, very, very good, and confirm if the endoscopy is suspicious. CT scan will confirm that it is a gastric volvulus. Again, barium X-ray is quite good at diagnosing patients who have got long-term off and on gastric volvulus. Barium X-ray is very good at diagnosing. However, when they are acutely blocked and nothing will go through, then swallowing barium is almost next to impossible for the patient. So again, the diagnosis of barium as an emergency becomes a bit limited, and I think CT scan as an emergency is the best way of diagnosing gastric volvulus. In 1/3 of these patients can have a hiatus hernia. And as I explained in my previous video, hiatus hernia is where the esophagus comes into the abdomen. There's a diaphragm, which is a muscular sheet which separates the chest from our tummy. There's a little hole in the middle, which is called the hiatus, and the esophagus joins the stomach. But in some patients, like in this case, the hole is very big. Instead of hole being this size, the hole is from here to here. Sometimes they can be so big so you can actually put a fist through it. The problem with that big hole is our belly is made out of muscle and our chest is covered by ribs. So there is not much pressure change in the chest as compared to the abdomen, because the only pressure change that is happening in the chest is by our lungs pumping air in and out. But in our tummy, because it's made out of muscle, every time we breathe, every time we cough, every time we get up, every time we lift a weight, our muscles in the belly, they contract. They contract. Every time they contract, if there is a hole at the top, that muscle inside try and push everything up. So I've got a balloon over here. Now think of this as the chest, which is fixed. This is the belly. This is our diaphragm. There is a hole in it called the hiatus hernia, like I've drawn over here. Now, whenever I press, because muscle in the belly is pressable, it press, the top end blows up. So all the pressure is going into the chest. But just under this hole, what is sitting? Under this hole, the structure that is sitting is the stomach. So every time the pressure inside the tummy goes up, the stomach is pushed through. Especially if there is a hiatus hernia. You can see in this case, almost all the stomach is sitting in the chest. This patient's symptoms, and this stomach up here can easily twist because all the attachments to the stomach are all stretched out or become very weak, because over the years, now this has happened not over days or months or few years, this has happened over decades. So this has been into the chest, and what the patients get is when they eat or drink, this blows up with air. When it blows up with air, they get chest pain. So when they eat, they get gas bloat, they get chest pain, they even think they might be having a heart attack. They can't take a deep breath in because they get breathless, because now stomach being in the chest, there is not enough space for the lung, especially the left lung, to expand. and they cannot take a deep breath. Now, most of these patients will require an operation to pull the stomach back. So, what in surgery, what the surgeon will do is pull the stomach back. So, there are two, three main things to do with gastric volvulus surgery. Patients who have got chronic off and on symptoms, it's not affecting their quality of life, it's certainly not causing them too much harm. They are the best patient because they're elderly, they're frail. The best treatment is to leave it alone. Keep an eye on them and see how they go. If things get worse, they can be treated. Sometimes the best treatment is no treatment. However, when somebody is completely blocked, they've got the stomach sitting in the chest, or they have a complete twist, they cannot keep anything down, then they will require surgery. So main principles of surgery is if there is hiatus hernia, try and close this hernia. Not always possible, not always easy. Sometimes the hole is so big that surgeons will have to put an artificial mesh in there to close it. But anyway, that is, I'm not going to go into details. Push the stomach back where it belongs, which is in the tummy. Then stitch the stomach, so strengthen its attachments, which are lacking. That is why the stomach is so floppy, and obviously make the stomach straight. So things will start going through normally, and the patient will have some quality of life, and there won't be any risk of stomach perforating. I hope this gave you some insight on gastric volvulus. Yes, I know it's a rare condition, but I thought it was an interesting condition to know. Thank you for watching.